Hi there, thanks for joining us on this Tuesday evening. We're going to start tonight's programme with a doctor from Leeds who developed long COVID and ME. She said NHS patients like her have been left to rot. Becky Williams caught COVID in March 2020 and has since been left housebound with a long list of symptoms, including extreme fatigue. Well, Dr Williams has now joined more than 200 healthcare workers in signing a letter calling for better care for patients with ME, which is also known as chronic fatigue syndrome. It's estimated to affect at least 250,000 people in the UK, although the ME associations say that's likely a significant underestimate. The government says it will ensure patients receive the care that they deserve. Our health correspondent Jamie Coulson reports.
They say I'm not a burden, but I can't help but feel that I am a burden when I have to ask for things. I used to be very independent, and now I have to ask for help to put my clothes on or help to get me to bed. It's heartbreaking.
Becky Williams caught COVID in March 2020. Until then, the 34-year-old doctor lived a fit and active life. But the virus left her with a long list of debilitating symptoms, including brain fog, pain and extreme fatigue. For the past 2 years, she's also met the criteria for ME, also known as chronic fatigue syndrome, which has many overlapping features with long COVID.
I've lost my job. I've just been stripped of my doctor training number because I've been off sick for too long. I've lost friends who don't want to get it or don't get it. I've lost my independence, my ability to drive, to look after myself, can't even wash my own hair. So these tablets are first thing in the morning.
Becky says the upset and frustration over her illness has been compounded by the quality of care she's received from parts of the NHS. She's joined more than 200 other healthcare workers in signing a letter supported by the campaign There for ME, raising concerns about the safety of ME patients and calling for urgent action.
I feel that we've all been left to rot, which I know sounds dramatic, but neglected and not being listened to. And this campaign is giving us all a voice. Just help me.
Her life. Her horizons have shrunk so much. She's suffering. We're suffering. Yeah, it's not great.
We've actually spent quite a lot of money to enable me to harvest my eggs, so that if I did get better, there was maybe a chance of being a mum one day. But I've only managed one round because it's knocked me back so much. And I think that's the thing that kills me. Not being able to be a mum. Can I have my blanket, please?
The government say they're committed to improving care for people with long COVID, ME and chronic fatigue syndrome, and recognise how devastating the symptoms can be. They say they welcome applications for high-quality research and are actively exploring next steps.
I try to be hopeful for the future. Because I don't think I could keep going if I didn't have hope. But I can't think too far into the future because it really scares me.
Jamie Coulson, BBC Look North.
Gosh, well, we wish her all the best. The realities there of ME for some people. Earlier I spoke to Karen Hargrave, who's the co-founder of the Therefore ME campaign, which is calling for better NHS care for patients with ME and long COVID. I started asking her why this campaign was so close to her heart.
I was diagnosed with ME as a result of long COVID, and I'm also a carer for my husband who has very severe ME to the point that he's reliant on full-time care. So absolutely, it's a patient and carer-led campaign that's very much come out of my experiences directly with this really awful disease.
And tell me about some of the complaints that you're hearing about when it comes to people with ME and long COVID.
There's all kinds of, I've got so many stories that I have myself and that I've heard from others of care that is, fundamentally unsafe, people deteriorating after receiving NHS care because they've been given inappropriate advice to exercise, or patients who've ended up in hospital with very, very severe symptoms, some of whom have sadly died as a result, and where there have been questions raised about the care that they've received. So we're really trying to highlight on World Patient Safety Day that, you know, we need, as people with ME and long COVID and people caring for them, we really need an NHS that's there for people with ME and long COVID and that can provide them with safe and appropriate care.
So what changes would you like to see, Karen?
I think number one, what we're calling for is a political commitment from the top of government. We want we'd like Wes Streeting, the Secretary of State for Health and Social Care, to recognise and acknowledge that the status quo for patients with ME and long COVID just isn't good enough, and commit to transforming NHS care so that the NHS, you know, it can be there for people with ME and long COVID when they really need it.
The government says it will ensure patients receive the care they deserve. Are you happy with that response?
What we really need now is action. We're really, we're looking from a high level political commitment to transforming care and to really, working with us, with our campaign, with the organisations that are backing our campaign. With the, today we organised an open letter to Wes Streeting that was signed by over 200 healthcare workers who would love to sit down with him and his colleagues and discuss how we can work together to transform care so that the NHS is there for people with ME and long COVID when they need it.
Karen Hargrave from There for ME, thanks for your time.
Great, thank you very much.